the Medicare Part B step therapy program ultimately applies to Medicare Advantage, where the drug therapies would be covered for these Medicare patients. Let me just give you like a brief history of where this program kind of came about. So back in 2012, the CMS released a memo that prohibited imposing mandatory step therapy to Part B drugs for the concerns with access. It stated that back then that Part B drugs or services were not permitted to have a step through other drugs, and that was kind of the requirement back in 2012. Now in 2018, the CMS first changed its position. So effective 1/1/2019, step therapy is now a permitted utilization management tool for Medicare Advantage patients for Part B drugs. However, back the first edition of this program, it has to be coupled with a care coordination program, as well as shared savings. At least 50% of the savings achieved through the step therapy program must be shared with the Medicare members. And that was the program that came out with the 2018 memo. Now, the current state of the program, in 2019, the rules changed again. So CMS again then came out with another memo stating that effective 1/1/2020, the care coordination component, as well as the rewards and incentive component, so the shared savings component, is no longer part of the requirement. So effective 1/1/2020, it's just a plain step therapy program that Medicare Advantage plan sponsors can elect to put in place. Now, the catch there is that these savings realized through the program must be reflected in the plan's bid. So in other words, it has to be reflected as revenue stream, and that has to go in for planning purposes the year prior. So from a health plan perspective, achieving cost savings and be able to allocate those savings to other services and these newer drugs that are coming out is a big priority for the Medicare Part B step therapy program. So based on CMS's own estimate, the savings for the trust fund are between 145 to 240 million for 2020 to 2029, which is an aggregate savings of over $1.9 billion over the course of 10 years. And the same story can be told for the patient side, where the CMS estimated a reduction for out-of-pocket costs between $5 to $8 million, which is an aggregate of $62 million over the course of 10 years. And these are very significant for this program, and something that Michelle can probably add on to this. Something that we're starting to see following the implementation of our own program is these types of savings.
For the most part, the drug lists aren't huge for the step therapy. A lot of folks started small and then expanded based on where their utilization was and where they kind of felt like the biggest bang for their buck was, and maybe just like low-hanging fruit to be able to say, well, stepping this drug first is very appropriate. So we have seen in our data that savings, especially initially, was really high. Like we saw quite a bit when it comes to, like, if you think of it from perhaps a PMPM perspective. So it was like over $1 PMPM in the first year. It decreased a little bit in the second year, but we kind of feel like that is something that is not uncommon because providers kind of get it. They understand what the preferred product is. So now it's just a matter of making sure that the drug is clinically appropriate and following that particular criteria. So I would certainly say that we have realized savings, and it's been, it like I said, it dropped off, but it's been fairly stable.